Now let me see.
Root canal, friend or foe? Have you or someone you know ever had a root canal done? Would it shock you if you learned that a study has linked it to be one of the causes of cancer? There are nearly 50 million teeth that are saved in the U.S. due to root canals. I will explain briefly what a root canal is. A root canal is a procedure where the dentist goes in and removes the nerve in the center of the tooth and the pulp that surrounds it. This is done usually because the decay has penetrated the center of the tooth and a normal filling is impossible because it would press on the nerve. Today I will be informing you about the different findings on root canals being linked to cancer and why researchers and some doctors believe this is true. Once finding out from my math teacher that root canals can cause cancer, it sparked an interest in me to do some research on it because I have had root canals done. So it got me to thinking, you too may have had a root canal and are not aware of the risks involved in them. It not only can cause cancer, but it can also pose other health risks. Today I will be discussing some of the studies that have been done in regards to root canals in general and other dangers root canals can have on your health and some other options that will prevent and reverse a root canal. First, I will discuss some studies that have been done in regards to root canals. Cancer and root canals may be more closely linked than you know. According to the Center of Natural Dentistry, vital organs in the human body are closely connected to the roots of our teeth. Dr. Price and the Mayo Clinic identified dozens of diseases related to bacterial toxins created by bacteria in the root canal. This bacteria has led to carcinogens accumulating in the linked organ, causing abnormal cell growth. Holistic dentists have claimed that if cancer develops in a region of the body that is linked to a root canal, treating the cancer will have little effect without getting the root canal reversed. Dr. Robert Jones, a researcher of the relationship between root canals and breast cancer, found an extremely high correlation between root canals and breast cancer. A 5-year study with over 300 cases, Dr. Jones found the following: 93% of women with breast cancer have had root canals, and 7% had other oral pathologies such as tumors. In the majority of cases occurred on the same side as the root canals or other oral pathologies. And now that I've discussed some of the studies that have been done, I will tell you some of the other dangers that root canals can have on our health. Fillings, root canals, and crowns can create a ticking time bomb for disease elsewhere in the body. Dentistry-caused problems can lead to autoimmune diseases, heart disease, and neurological disease. But don't expect your dentist to tell you these things. In fact, they may not even know about these dangers because the American Dental Association denies the problem exists despite all the evidence. According to Dr. Huggins, anaerobic bacteria is a deadly bacteria that thrive without oxygen and can be taken up residence in the dead tooth and form this safe haven and then shed into your bloodstream where they can affect your heart valves, joints, or other organs, as well as damage the immune system. Root canals are a huge overlooked source of chronic inflammation and infection. And last, I will tell you there are ways to prevent having to have a root canal, an option you have to get one reversed. You can have your tooth pulled, keeping your teeth clean, or keeping your teeth healthy by brushing at least twice a day and flossing. Getting your teeth cleaned every 6 months by your dentist. And taking certain vitamins. And you can also get a root canal reversed. And you can do this by, you can see a holistic dentist, and what a holistic dentist does is they perform a dentistry that is good for the body as well as the teeth and gums. The effect of toxic metals such as mercury and silver fillings is one area of concern addressed by the holistic dentist by replacing silver fillings with non-toxic composite fillings and sucking out the toxins from your mouth with a special vacuum-like tool. This will greatly decrease risk of cancer and other diseases. And in concluding this topic, I hope I was able to inform you of the risks of having a root canal and preventative measures that you can use to keep from having to have one done. We have talked about studies that have been done, dangers it has on our health, options you have to prevent and reverse the root canal. And after doing this research on this topic, I am amazed at how risky root canals can be to our health. I wonder how many people out there are struggling with cancer or some other health problem that may be linked to a root canal that they have had. Thank you.